Hi, my name is Matthew. I'm a student physical therapist assistant at Owens Community College. Today I'll be going over some of the measurements that someone would go through to fit themselves for a wheelchair, as well as some of the functions and the reasonings behind some of the functions of a wheelchair. First, we'll start out with the measurements. And the first measurement we'll do is the seat depth, so from the front of the seat to the back of the seat. And what we would do for this is measure from the back of the knee back to the furthest point of the butt, and we would add 2 inches to that. And why we would add the 2 inches would be some of these chairs have the ability to put on different backs, and some of those are a little bit more thick and have more padding, so that would take away some of the seat depth, making it less comfortable for the person in the chair. The next measurement is the seat width, so from side to side, and we would go from the furthest point of the hips as the measurement, and then we would also add 1 to 2 inches to that to give the patient some wiggle room to make it more comfortable and safe when getting in and out of the chair, as well as being able to move within the chair and not be restricted. The next one we will go through is the back height. In the back height, it is very important to take it from the armpit to the seat of the chair, and then subtract 4 inches. And we are going to subtract those 4 inches because if a patient was relying on themselves to wheel the chair, the constant moving their arms back, if it's too short, will rub against this and make it harder to move the chair by themselves. And also it could leave themselves with some wounds because of the rubbing. And it's very uncomfortable with that rubbing. And then the armrest height. For the armrest height, we want the arms at a 90-degree angle, as if you were sitting in a chair. And then we will measure from the base of the seat to the elbow, or the arm in general. And then we're going to add 1 inch. And we're adding this inch again for the wiggle room. If there is a seat cushion added, it will raise the person up just a little bit. And it's a little bit of just a wiggle space to that regards. The lower leg length. The lower leg length, we are going to be seated in the chair. And we are going to go from the back of the knee all the way down to the heel. We want the knees particularly to be at a 90-degree angle, as well as the feet flat on the floor to get the best measurement possible. And then with that, we're going to add 2 inches again for that wiggle room if something is to change both physically or environmentally. Lastly, we have the foot plates. And simply for the foot plates, we want the patient, when sitting in the chair, there needs to be roughly about 90 degrees for the most comfortable seat, as well as we want the foot plate to be at least 2 inches off of the ground so that it's not scraping or running things over. Next, we're going to go over some of the functions. The first function we'll be going over is the push rims. The push rims are on the sides of these back wheels here. And what these push rims are for is if a patient is, again, like I said earlier, dependent on moving themselves, they're able to wheel themselves forward and backward, as well as turning. This is their propulsion while being in the chair. As well as the push rims in the back wheels, we have the caster wheels, which are these wheels here in the front, which are right here. These caster wheels are what is going to allow you, like I just did there, to spin the chair, to turn the chair. If you're going straight and then you got to go left somewhere, you're able to turn that chair and pivot it around. And that is the caster wheels, the steering wheels is what you could call them. Lastly, we have the wheel locks, which is simple enough. It is just a lock. There is a lever on the side right here. And if I push this lever out, it is going to push down the lock, making sure that I cannot move this wheel. Pulling the lever towards me will disengage the lock, so I am again then able to move that wheel. Obviously, these are important if going up a steep incline or any time that you would need to make sure that the patient in the chair is not rolling away. Lastly, what we're going to get into is some of the removable objects, that being the armrest and the leg rests. The armrest, push the pin, sometimes it's not easy, and pull it out like that. There's the pin right here, just push that and it'll release. We would take these out for cases of a slide board. If a patient needs slide board to transfer, they're able to put it directly onto the seat instead of putting it on the armrest, which means that the patient would have to drop themselves down, which we do not want. Lastly, what we'll be going over, like I said, is the leg rests. And the leg rests, there are a lever here on the inside. You would just pull that lever, it'll spin out. And then there are 2 pins that it'll pull off of to release those leg rests. Again, there is a lever, just pull that back, it'll release it, and then you pull it off of the pins. And a reason that we would do that would be for a patient who doesn't necessarily always want to wheel themselves with the guide wheels, the guide rims rather, but they want to be able to use their legs. It just gives them less things to trip on while trying to wheel themselves, as well as patients who need to transfer. We would take those off so that they have nothing in their way, in their path. That is, I believe, everything. These are some of the, like I went over the measurements and some of the functions of the wheelchair, as well as why we would have these functions put into our wheelchair. That is it, and thank you for your time.